My name is Dr. Alex Chun. I'm one of the newer family doctors here from town. A lot of my training, a lot of my life prior to moving up to Kirkland Lake has been in essentially been in the GTA. And I often get asked the question, you don't have family from here, you don't have any connections here, what brings you to Kirkland Lake? And when I first did a site visit here, I asked myself, why am I visiting up here? But soon after getting here, I realized this was a great spot to be. And the comprehensiveness of the practice and scope of practice here is second to none. When you're up here, you have everything that you want to do, as much or as little as you want to do too. So as a family doctor, of course, one of our primary things is working in the clinic. So myself particularly, I have an older practice, but you can have a practice that's younger, older, spread out. It can be whatever you want it to be. And the clinic is very well supported with the up-to-date EMR system, PSS, Practice Solutions. The staff, both administrative and the allied health, dietitian, nurse practitioner, RNs, there's a lot of support there, so you don't have to feel that you're there on your own. In addition to having the family practice, I do nursing homes. So there's 2 nursing homes in town, one called Extended Care and one called TPR. I'm the medical director and the lead physician at TPR, so I spend 1 full day there. There's a nurse practitioner as well that kind of offloads some of the extra work that may happen at TPR, but if you have interest in long-term care and care of the elderly, that's something that's really important and really big in my practice here. In addition to that, obviously inpatient hospitalist-based work is something that I incorporate regularly in my schedule. So I do roughly 1 in 6 weeks of inpatient hospitalist care where you're taking care of 15 to 20 active acute patients. In addition to that, we do have a component of ICU, multi-bed ICU department, where oftentimes these are critical ill patients. It's oftentimes on pressors, ventilation support, invasive lines, so you can do a lot of procedures and a lot of acute care medicine. And the important thing is that you don't feel isolated or unsupported. We have a partnership through something called virtual critical care, which we contact with Sudbury, with their intensivist and their ICU department there, which gives a lot of guidance, a lot of help, so you don't feel unsupported. The medicine aspect, it's comprehensive, it's multifocal, it's personally, it's very enjoyable. It makes me feel like I'm actually doing something, and that's something that's really, really important to me, and it's been great so far. The other aspect of moving to Kirkland Lake was there's good outdoor activities, hiking, snowmobiling, whatever the season, there's always something to be doing. It's a beautiful place. It's serene, it's quiet, it's peaceful, it's beautiful. You get to unwind, you get to live a lifestyle that's not like the city. That was the biggest reason why I moved out from Toronto. But you still can go to Toronto. There was a time where there were very few physicians up here, so the community, when they see you as a physician, they see you as a resident, they are very appreciative. And the community's been kind of supporting us as our little group of doctors here. And so it's this mix of community, inclusivity, living at the lake, living in nature, doing all the things that nature has, and then having ultimately that scope of practice, the comprehensiveness of practice on a day-to-day basis, feel like you're making a difference, keeping yourself interested in medicine. Those are the things that brought me to Kirkland Lake.